Hi, Mindy Paulette, Health and Wellness Advisor with Henriette Group. I'm here today with Brian Garcia from Proactive MD. So welcome, Brian.
Thank you.
Yeah, so Brian's here to tell us a little bit about what Proactive MD, like who they are and what they do. So Brian, I'm going to turn it over to you and tell us a little bit about yourself.
All right. Again, my name is Brian Garcia, and I've been with Proactive MD for, it seems like a long time. One of our legacy companies has been around since 2008, and so a few years after that is when I joined the company. I've been in the healthcare space for a long time as well, and Proactive MD is one of those companies that's actually trying to fix healthcare, really. And so the company itself is what we do is we partner with employer groups and employers of any size, really, and we are providing advanced primary care to the employees and also their families. And then our model also extends even beyond the clinic walls by navigating and helping folks coordinate throughout the entire healthcare continuum.
And so for an employer, so what's the benefit of integrating or bringing in a Proactive MD when you have an existing health plan? Like, what's the benefit to that? Are there savings to that, or how does that work?
Sure. So on the employer side and on the employee side, there definitely is savings. For the employers, there is a return on investment, and how we really figure an ROI is what kind of savings is happening for the whole total cost of healthcare for that particular patient. So they're saving money that way as employers. They're also getting the benefits of their employees and their dependents, obviously, able to not be out all day long for just one doctor's visit. So the access to the care is easy, and you also are able to spend time with the providers, and then you're not sitting in a waiting room forever. So typical things that normally happen in like a fee-for-service type of environment, they're not happening with our Proactive MD health centers. The employees themselves also do save money because they're not having to pay any copays. They're not paying for some of their meds and labs. They're included in the pricing. And so, that helps reduce copays at the pharmacy as well, too. So the employees are able to save money that way. If the employer is on a self-funded plan, they really are going to have a very big impact on that healthcare spend. And then the other thing that really helps us stand out is our whole patient advocacy program. And so, patient advocacy sometimes can maybe be looked at as care coordination or care navigation. And that's only a couple of the things that the patient advocate really does. They are looking at that data and seeing, okay, I need to make sure that I engage with this patient. So what they're trying to do is really engage with the patients that are high risk or about to be high risk. And if you're a high risk patient, you're going to be a high cost claimant as well, too.
Yeah.
So that affects an employer's healthcare spend that way. That patient advocate is going to take that hand of that patient and hold that hand and really close that gap of healthcare consumerism and help bring that patient through the entire thing. So what that helps us do as Proactive MD is we're really affecting and causing, when it comes to healthcare, behavioral change. So the engagement in everything that we do with that patient is really causing a behavioral change when it comes to healthcare.
Mm-hmm. So I like also with the patient advocate, I mean, you're right. Like people, we're in charge of our own health, and we can tell people to be in charge of their own health, but people don't really know what that means, or where do I go for that and how do I manage that? But the other thing I think I like about the patient advocacy program is that that person can also reinforce what's happening at the employer level in that group. So if there are things like that a broker, figures out, or your data science team figures out that something that's bubbling up as conditions or high cost, then I think it's unique in that your patient advocate can actually work with the employer to make sure that when that employee is coming in, they're also reinforcing the other things, that ways that the patient needs to be driven or things like that, or other initiatives that the employer might be putting in place is just another touch point to kind of help reinforce that stuff. So
Yeah, oh yeah, absolutely. And they're going to be doing everything to to maximize the benefits and the benefit plan that consultants and the employers have gotten together and designed. And so the patient advocate's going to help with that as well too. And then we do look at it from a population health lens as well too. So not just a personal one-on-one health lens, but the population as well.
And so your model now, do you have like shared spaces, right? So employers might not be learning to kind of build out their own space. They can join an existing space, right?
Mm-hmm. Right. Yes. So absolutely, we do have some of our employers. They just strictly want their clinic or their health center, mm-hmm. and they want it on site, and so we do that as well. So we do have a lot of on-site areas, and it's more based along the lines of like a comprehensive fixed fee. So they know what they're going to spend annually, basically, and that really helps with budgeting purposes for the employer. But then on the other side of that too, yes, we have shared site clinics or near site clinics. And basically that's, our direct care model. And as I had mentioned earlier on, employees of any size are able to join. So if you're an employee and you have 2 employees, most of the time those type of groups won't have insurance or any type of health insurance, but really it's a matter of at least getting them engaged with health care. Mm-hmm. We don't take care of the major medical things on the insurance side, but at least we're providing that advanced primary care, which most of the time that's 90% of your healthcare needs anyway. Mm-hmm. So the shared clinics that we have, again, employers of any size are able to join, and it's just a monthly membership fee at that point.
So if someone's interested in finding out more, or if they're near a location where you're opening up, like what's the best way to reach out to you or to get in touch with you or connect with you?
Email address is bgarcia@proactive.md. And then my direct line or my cell phone number is 812-605-0432.
And also with Henriette Group as a consultant, we're happy to make connections as well with Proactive MD, but you can reach out to me and Paulette at henriette.com or connect with me on LinkedIn.